Good. Thank you, everyone, for attending today. We're pleased that you could be here. We wanted to talk a little bit more about some of our new behavioral health metrics dashboard set. This is something we've been codenaming Matterhorn. We wanted to talk a little bit about it, give you a little bit of a peek into this, and this is something we've been working hard on, and will be available here shortly for installation. So please feel free to ask any questions you may have, and we'd love to entertain any questions or anything that you could possibly send our way. So this is something we've codenamed Matterhorn. Now in the future, we'll probably give it a little bit different name. And for this presentation, I'm calling this Behavioral Health Metric Dashboard Set. So go ahead with this. So just a quick background on Pinnacle. For those of you who don't know Pinnacle, we've been in behavioral health data consulting for about a little over 20 years, probably. Enterprise data warehousing for a whole suite of electronic medical records. We're adding more all the time. Credible, Avatar, Harris, Athena, Info, MC, a bunch. So we're constantly integrating new stuff, next gen, things like that. This is part of an active webinar and user group effort. We have these hopefully once a month or once every other month, we try to get together and have user groups as well as these webinars. So I'm trying to present some interesting information and ask questions if you want to. And we'd like to thank Julie Reidman, who's here at Pinnacle, and she's helped facilitate this today. So we thank her for getting the word out and helping to facilitate this. So today I want to talk about this behavioral health metric dashboard set and kind of the foundations of it, and why we sort of undertook this. You know, we've been doing data for many years, and we built thousands of reports and dashboards, and we wanted to kind of try to build a set that was kind of more generic. We could drop in on any system that was more agnostic to the electronic medical record. And so we got together with some individuals in the field who also have a lot of experience and said, you know, what are the 10, 15 different metrics that kind of help us steer our organization? You know, if these 15 metrics are good to go, then you know you're in pretty good shape. Not that there won't be a lot of other things you need to report on, but you know, what are those 15? I think we came up with 16 or 17 in total. And this Matterhorn data set is what we came up with, and it has multiple layers. And we're going to show a little bit about these layers. So it has a relational foundation, and that's totally exposed to you if you have this, and you can query it with SQL Server, and we'll look at that real quick here in a minute. And so it's based on structured query language, and that's the base layer. But then we also ETL, extract, transform, load that up into a star schema measure and dimension table structure. And then we put that in an OLAP cube. And so it's very fast. So it's all in memory and pre-compiled. And where possible, we build the database or the dashboards on the OLAP layer just because it's so fast. And then we're developing dashboard sets in SQL Reporting Services and Power BI for the Matterhorn dashboard. So there's some advantages to both of those, I think, and we'll talk about those for just a minute. So the two platforms that we have are SQL Reporting Services, and SQL Reporting Services is a very mature tool. It's been around for a long time. They've recently updated that. It enables pixel perfect placement of elements. It has a full expression language based on Visual Basic. It's considered a development tool by Microsoft. So you have all your version control and all that stuff. You use Visual Studio, which is their flagship development tool for SQL Reporting Services. It's got the full modern graphics set. The recent version has the full HTML5, so it looks really great. The nice thing about it is it's often included in your SQL licensing, and so there's not usually a lot of extra cost, and you're able to do a lot of really powerful things with SQL Reporting Services still. Has broad support. It supports MDX, DAX, direct query, all the different ways you can connect to it. And it's very, very powerful. Now, of course, Power BI is kind of the hot thing. Everybody's talking about Power BI, and it looks great, and it's highly interactive. It's mostly cloud-based, and Microsoft usually charges you extra if you're doing any more than just using it to try it out and things. So there's usually extra cost to it. It does enable rapid development, has a broad user base, lots of custom visuals. It does support the DAX language, so you can do calculations and things in it. So, but we wanted to kind of focus on both, just because some people want to use SQL Reporting Services. It's what they've always used. It looks great. It's very supportable. It's fast. But others want to get into the Power BI side of things, and so we want to support that as well. Okay, so real quick, let me go over some of the areas and how we came up with some of the metrics. So, any agency must remain viable, and that's really all about resources and being good stewards of the resources that your agency has, and being able to utilize those. We need to engage the clients and make sure that we're following up with them, and that we are making sure that we meet the needs of the clients. We also want to plan for the future, so we want to make sure that we're planning for the coming weeks, and we're utilizing our resources. If we don't have anything planned for next week, but yet we have a waiting list that's big and that's long, then that's a problem. We need to make sure we're planning and we're accounting for our no-shows and our missed appointments into the future. We need to have timely recording and billing. So notes need to be recorded, bills need to be processed, and we need to make sure that those are happening in a timely fashion, and that basically we have an efficient and effective operation. Now, I know everyone has their own reports and everybody has systems, but we kind of wanted to come up with kind of a standard set that we could focus on. So what we look at in here is time to note, time to claim, time to payment. Those can all be quite different in different systems. We need to get those notes recorded. We need to get those, get the claims built, and then we want to make sure that we're getting payment back into the system. And so we'll track those. Time since last service. How long has it been? Do we need to engage with clients? Are we making sure that we're reaching out to clients and getting them back in if they need to come back in? We want to look at engagement density, we call it. That's encounters over unique clients. What's that value looking like? We call that engagement density. Duration, we want to track duration. We want to look at revenue detail. That's payments, balances, adjustments, etc. We want to track those and make sure we have a handle on those. Then we want to, of course, look at client and service counts. Those are pretty basic, but it's nice to have a handle on those. We want to look at missed appointments and cancellations, and then future scheduling. That helps us manage perhaps our wait list a little bit better. So if we're scheduling into the coming week, and what do we have coming in the next week, we want to make sure we have a good volume of appointments in the coming week. And so those are some of the things we're tracking in this set. There's another aspect of this. We're also developing what we call Matterhorn MX, which is an optional participation in a de-identified data aggregation. So we're developing a way to de-identify kind of an aggregate set, and people who want to opt into that, they can allow us to just pull some aggregate numbers and then make that available back to you, and so you can track your metrics across time, and also against similar agencies. You know, what are other agencies doing? And that's an automated system. Like I said, it's de-identified. There's no names. It's just aggregate numbers, and then and only we know the keys of what agency submitted that data. So that's kind of a wrinkle on this that we'll talk more about later. But it's a little bit of a data aggregation system. So let me see, before I get into these a little bit, let me pause for a moment. I just wanted to bring up a couple of things here. So as I mentioned before, we have there's a couple of layers here that we want to show you. And so one of the layers, as you can see here, you have access to the cube. So you have access to all the tables. So here's an example of, just very quickly, in Excel, you can see all the measures and dimensions over here in the Matterhorn cube. You know, we have different measures for next week appointments, no-show measures. And we have a whole bunch of service measures, as you can see here. We have aging measures in there, average days since last service, average days time to claim, balance, billable service count, days since last service, engagement density, mental health service measure count, no progress note sign count, non-billable service count, payments for counting, progress notes. So really everything you'd need to track any of these metrics that we've talked about is in the cube. And so you can build your own reports, right? You don't, I mean, we have these standard reports we're gonna have, but you can certainly have your own reports, and you can use this tool to build reports that you might need. And so you'd have all of these items in here. So, you know, up here I brought in canceled appointment count, missed appointment count by appointment cost center, month start date, and appointment service item. So, you know, very easily I can go through here and look at any of these values. So if I wanted to I wanted to clear all these values, I could very easily. And I could say, you know, I don't want to look at missed appointments. I want to look at something completely different. Let's look at, you know, revenue. Let's see, we'll look at revenue in here. And we can bring that in. And so very quickly you can see that you can bring in other values from the cube. I need to take out our appointment cost center. Let's take that out. Let's leave revenue in there. And we can put in, let's bring in, not the no-show, but let's bring in service dimension. And we have our place of service, for example. We can also break that down by month. So even though the dashboard's right on top of all this, you still have all this underlying data structure that you can use for anything you want, right? So I've just dropped in place of service, you know, service year month string, service year month, and very quickly I can build a completely different report, just that quick. So you have access to all of these items, and these are the underlying pieces that support these dashboards. So you have all of the relational database structure, and then you have the OLAP cube as well underneath it. And so you can utilize all those items as well. I wanted to just show that. Let me jump back into the presentation here. Okay. Okay. So the Power BI versions we bring a lot of different, we try to put a lot of information on the screen at one time. So for example, this is an inner service value view. We want to give you average days. Inner service value is days since last service. And so, we want to give you, kind of an overview with drill down, break it down by age, break it down by delivery method. We break it down by the average total days since last service. We like to use these box and whisker charts so we can see the data variance. This is an example here where we can see that the data variance, which is so in your box and whisker chart here for the inner service value, you can see the dark color is your 75th to your 25th percentile, and then your whiskers on the box are your outliers. So you can see for this dashboard, you're seeing that value is starting to come down. So that's exactly what you want to see. And the charts and the line charts are nice, but the bar graphs or the box and whisker charts are nice. And so you see that we have the ability to kind of see the trends and to see how your data is looking over time. And the Power BI version, you'll navigate across the bottom and you'll have all of those different metrics. And let me show you here. So you'll have node entry, like we talked about, time to node entry, time to claim, time to payment, inner service value, engagement, duration, revenue, adjusted revenue, transfers, adjustments, payments, balance, client count, services count, no show rate, unseen last 45, miss services from appointments, and then this week's appointments compared to the coming week's appointments. And so you'll be able to look at all of these metrics in this same view, and the view will change, of course, based on what you select. So, and again, you'll have these Power BI dashboards. You can take them apart and redo them and rebuild them and do what you want with them. You can make new ones, but hopefully it'll give you a good overview. It's something you could distribute out immediately to management if you have a method to do so. If you have the on-premise Power BI report server, you can do that. If you have the cloud service, you can deploy them out as well to that. So very interactive, and like I said, they're very nice looking, and they'll provide you with a lot of information just right off the bat. Our hope is that you'll kind of use the underlying data structures to build new things, but this is something that you can very quickly roll out and utilize. All right. And then the Power or the SQL Reporting Services versions are similar. They don't quite look the same just because the visualizations in the SQL Reporting Services are a little bit different, but you can see that it's going to the view is going to change. You're going to have time to note, time to claim, time to payment, all those same metrics, and a bunch of different visualizations for each one, and then comparative dashboards for each item. And so you can use those to monitor performance in all of those areas. And again, you can take these and open them in Visual Studio and take them apart and rebuild them and reuse them for whatever you'd like to use them for. Any questions from the group? Anybody have any questions? Okay. Well, we wanted to just kind of give an overview of those and do that quickly and see if there's anybody that has any questions or comments. And that was really the extent of what I wanted to talk about today. If you'd like to see stuff more in depth, we'd love to give you kind of an in-depth one-on-one presentation. And get down into these full data layers for reporting. We can, if you have people that like to write in SQL, they can write in SQL, and they can use the relational layer. You can also use the OLAP layer. You can access them through Excel. You can use the dashboards, and the idea is that they're agnostic as far as your electronic medical record. So if you're an Avatar, Profiler, Credible, whichever ones, we've built an integration for each one of those, and so you can utilize those as you wish. So very exciting. And again, we did mention that we are moving towards kind of a data aggregation system. If anyone's interested in participating in that, that's something else we would like to talk about. So it's kind of an exciting thing that we've developed, and perhaps we'll do another session next month and kind of maybe focus in on one area and go into it, maybe time to claim or something, and kind of talk about how that rolls out and how you can use that in the day-to-day operation of your agency. So anyway, with that, I wrap up with just a short webinar today. We'll let you get back to work. We appreciate everyone coming. If anyone has any questions, feel free to get with us. If you don't have my contact information already, we're happy to provide that. And we appreciate everyone attending today. So thank you very much. If there's no questions, we'll go ahead and wrap up. Thank you very much. Take care.